Hey everyone, JJ here. I've been griping a little bit about John, my video editor and brother. It's been taking him a little while to get the last couple updates up. So drop him a comment, tell him he's doing great work, but timely updates call for timely uploads, and we're going to dedicate getting these videos out quicker, more timely. Also, thanks a lot for your feedback. We've upgraded the audio system, so lavalier mics that we got from Best Buy, and hopefully that improves the audio quality going forward. So really appreciate the support. Thanks again. Keep dropping feedback to us. Looking forward to getting this channel to grow. And my early subscribers, all of you guys, big part, big thanks. So quick update here. Wanted to go over where I left off on the last video, which was talking a little bit more about COVID, its impact on the economy, its impact on the stock market, but also its impact on all of us here locally and in communities. So first, update on the local side. We live just a number of miles outside of the Chicagoland area, and there's 3 counties that have regressed back because positivity rates have started to spike. So the 3 counties where there is a 9% plus positivity rate are Will County, DuPage County, and Kane County. All of those counties have now been placed on additional restrictions by Governor J.B. Pritzker. Restaurants and bars can no longer have dine-in service. So in addition to all of the restrictions that are already in place, large gatherings have been reduced to under 25, and guidance has been you should have less than 6 people that aren't family members at your home. So not going to be an easy thing to continue to control, but we understand that positivity rates are rising and we want that number to go down. So what does that mean? The positivity rate is the number of people that test positive for COVID divided by the number of people tested for COVID. So the way to reopen businesses is if we have a positivity rate for a 3-day period that goes under 6.5% in the 3 counties that I mentioned. That will help lift restrictions and really take this time to support the restaurants with to-go, buy gift cards. Just make sure that you're doing your best to work with the businesses that really need it now. Okay, regarding treatments, what's changed over the last couple of months, some of the positive highlights there. What we've seen is a number of politicians have tested positive for COVID. 2 big names have been Donald Trump and Chris Christie. Donald Trump is in his mid-70s. Chris Christie is not the healthiest guy out there. He's in his late 50s. Chris Christie had a very tough time with COVID. He was in the hospital for 7 days. But I want to talk about the treatments that both politicians received. The first one is the newest FDA-approved drug for COVID, which is produced by Gilead, ticker symbol GILD. The drug is remdesivir. So both Donald Trump as well as Chris Christie were on a 5-day cycle of remdesivir. Remdesivir is widely available and now FDA approved. The next treatment is monoclonal antibodies. So there's 2 companies producing these. One is Regeneron and the other one is Eli Lilly. Now, I want to caution, but Trump said and called this almost a cure. It's not a cure. There's no cure for COVID, but it is showing effectiveness, but it's not FDA approved. They're looking to get emergency use authorization to see if this is something that can be given to people that are struggling with COVID, emergency use is not FDA approval. Remdesivir, FDA approved. Monoclonal antibodies worked for some politicians, but not fully approved yet from the FDA. All right. So next thing I want to talk about is vaccines. There is a race towards a vaccine. There are a number of companies that are in phase 3 trials, and this is happening, quite frankly, in record time. The possibility of a vaccine in 2020 is real. It's there. So one company that I'm following more closely on the phase 3 trial end is Moderna, ticker symbol mRNA. And Moderna is a biotech company that has a phase 3 trial in place. They just actually closed the phase 3 trial enrollment, and they enrolled over 30,000 people in their vaccine trial. That's a big number. There's a lot of people that are trying this vaccine. And they've came out and said it's a possibility that they have a vaccine available in December of this year. Now, if that vaccine does become available, which we're hoping for, then the next challenge is going to become distribution. How quickly can the US government, in partnership perhaps with the private sector like a CVS, Walgreens, doctors across the country, how can we get a vaccine very, very quickly out to the American people, especially the most vulnerable and first responders, people working on the front line? How do we get this to them? Let's talk a little bit more about that on the next videos. Thanks so much again for clicking the like button if this is something that was helpful to you, and subscribe if this is something that is very helpful. So thanks so much. Really appreciate you guys tuning in.